Hey, Dr. Heather here, just coming online to show you a little bit of why we do BioScope, why I created it, what is the differentiating factors in incorporating it into your practice, why it's so helpful. So just real quick, I have some images. I'm gonna go through the first one here. You can see it's it's that one that I wanna go over first. Very pale, the color is very different from the next one over, which is very red. So the pale, this is where, as a professional, you get to question your patients or clients. Is their diet sufficient in protein? If it is, it's a full sulfur deficiency. If it has a little bit more of a green tinge to it, then we know they have a fungal issue. Now, this might be the case. You can see it's a little bit more greener on the outside than on the other side, but the main thing that stands out there is that huge black center. So this is how wildly different, these are all different people and how different they can be. So that is a toxic gut. And then the white polymered protein puddles is what those are called. You don't have to describe this to your patient. It's just oxidative stress enough to be damaging the body. In this area is the gut and going out into the joints. I bet this person feels it in their joints. So speaking of which, the next one over here would be this nice rich color. However, the white ring is very specifically in the joints and connective tissues that this person is feeling. They do need to work on gut microbiome balance. That center is very dark. And then another thing that we can see here is, well, I won't go over that, but the next one over, just to speed through these, give you an idea, this widespread inflammation. This is systemic, this is throughout their body. Sometimes people feel this, sometimes they don't, but this is what's so enlightening about it. Here we see the lymphatic ring. So there's a very dark center, kind of like almost bubbles up when I'm looking at it under the microscope. And that would just show us that the lymphatic system is congested. Now the last one, you see these rings of darkness, and that could be toxins if they're having an immune reaction. So be questioning them on that, but it is most likely just kidney stress. And so the other thing that we see from this is those itty bitty little polka dots, those little specks of white in the very center, and that is, we always want to check adrenal fatigue. Most people have that, right? But food sensitivities. So the priority here would actually be not to test toxins because we're all exposed unless they're having specific symptoms of toxin overload. Something that you want to really test for is like lead or aluminum. But really, our body is exposed to these things. If they're living a clean lifestyle and you're guiding them through all of that and they're cleaning up their diet, we're exposed to toxins. It's a part of life, but our body should be able to handle it. What we want to be doing is supporting the kidneys in this case, and then it's prioritizing the food sensitivities. We need to figure out what they are doing to create this stress. And then when we see the report and all the biochemical imbalances from the urine, we get to piece this together. So I just wanted to go over that real quick, how impactful it can be, and those images are relatable. You're literally getting to speak the language of your patient. It's something that they actually look forward to. Oh. So that's my slide I wanted to show you. This, those blood spots on the microscope is called the Bolin technique. There's a couple different techniques, but what I really want to highlight here is it's the original cancer screening. This was not the Bolin technique, but before that, in the 1930s, there was a doctor that went to the bedside of patients and developed this technique to see how severe the patient was, and then mainly looking for cancer. So we're getting to measure that oxidative stress. That is really what is causing the cancer. That inflammation and toxins, as we know, fungal issues will definitely get us there. And how well is the lymphatic system? These are all root cause issues, the gut microbiome, kidney stress, parasites, and toxins. That is what we're looking at here. So it's your roadmap, and it's, I don't know of any other test that tests so many things for under $200. It's quite incredible. So just as a reminder, there's the little lancet. We take the blood and the urine, and this is something I'm proposing that we have patients do as a baseline, as part of what we will be reviewing with them at their first appointment. So this is something you can just send them out the kits, and I analyze it and get you the report, and you would just make it clear the deadline before they see you. So hopefully you're to the place in your practice where you're scheduling people out at least 2 weeks, and then we get to do this first. So it's the first step. They get engaged right away. They can either, like I said, have the kits mailed out to them if you want to be completely hands-off, or if you want to kind of nurture that process and make sure that it happens, just have an assistant or yourself spend 10 minutes with them and then send them home. They can send out the kits, or you could even send it for them. Wrong way. There we go. So this, like I said, is the baseline. We're just mapping where they are at, and then ideally we're measuring their improvements. Any changes you can see in these ways before they start to feel it, or any other test would start to show. So I really encourage you to get started, and I'm excited. Take care.